Conference, I call upon you to reject this motion. I won't deny that the Lib Dems have secured changes to the bill, and lines 7 to 18 in particular create the premise of success. But Conference, I would argue that the premise is all they represent. At the very best, they are platitudinous. Who am I to say this? I was made redundant by the NHS Bill. I was made redundant by this bill before consultation with our party finished. I was made redundant before last year's spring conference. One could ask, pause, what pause? I worked in patient experience, working with patients to make sure that their experience of the NHS were viable and that we could use their information to improve our services. As Liberal Democrats, this is a value that we wholeheartedly support. Now, I know from colleagues, the 3 colleagues left from my department of 7, who are covering a geographic area 4 times as big, that patient experience is no longer valued. All this has happened in the last year. We believe that we are obtaining concessions, but the truth is, these concessions at ground level are being ignored. We look at public health and maintaining the independence of public health. How many of you are councillors and have spoken to me in the last couple of days saying that you are not represented on health and wellbeing boards, saying that you have no opportunity to shape the NHS in your local area? How many of us wanted to see democratic responsibility within the NHS, and we are now seeing that it is not happening? This motion calls for further endeavours, but ultimately to pass the bill. But should we not first demand that the endeavours that we pushed through at last year's spring conference are evidence to actually be working? Conference, I call on you to reject this motion. Thank you.